Today, joining us, we have the Newport Health Equity Zone.
Awesome. And we're doing something a little different today.
We're doing a two-part. Not only do we have Director Sydney Ormerod from the Health Equity Zone, but we also have the community health worker Joyce Sims joining us today. So that's going to be.
Yes, I'd love to hear about the HES. So many questions around the HES. Love their model, including the community.
Yes, very important. I know they have a huge emphasis on Newport's North End, which is greatly appreciated. I remember the mural that they did, really community oriented. So it's going to be great to hear the work that they've done, the work that they're going to do, the work they hope to accomplish as well.
Absolutely.
All right. Without further ado. So today, our guest, Strategy Manager of Prevention at the Women's Resource Center, Sydney Ormerod. How are you today, Sydney?
I am doing well. How are you?
Doing pretty good. Thank you for being our guest today on Totally Preventable. We greatly appreciate it. Got a lot of questions for you. We're very eager to learn. So we'll just jump right into it.
Sounds good.
What is a health equity zone?
Yeah, so a Health Equity Zone started as a place-based initiative with the goal of investing in communities within Rhode Island to work towards becoming a healthier and more resilient place to work, to live, to play. To be a little more specific, HES's goals are to invest in individuals' capacity building, to make change within their community, and to be able to have the skills needed to challenge the systems that have been put into place and have created these enormous inequities that we see every day.
Can you explain what the benefits to a healthier and more resilient community might be?
Yeah, the benefits. There's so many benefits to living a healthier life. You sit in a doctor's office and you read posters and you listen to commercials that come out about why you should maintain your health, right? And why you should go to the doctors or eat right. But you don't often hear when you're in those environments is how your community can be affecting your health and your overall being directly, exactly where you live. And when communities are healthier and more resilient, that kind of shows through the people that live there. When communities are allowing the opportunities for residents to be better connected, to gain that sense of cohesion and partnership, so many things can blossom from that. When individuals are given the same opportunities, the same voice, the same seat at the table as everybody else, being a part of the decisions that are being made for you is creating a healthier life for a person. Ensuring that more jobs are available and you're a part of those decisions of what jobs are available, the pay that you're giving and you're a part of those conversations, all those contribute to one's health. Someone can know what they need from those posters and those commercials that we see, but having the access to those opportunities, you're creating a healthier environment filled with overall more resilient people.
Now I'm just going to backtrack a little because we jumped right into it, my fault. But your position, how does that tie into HES? Your position states the Women's Resource Center. How does it tie into HES?
Sure, yeah. So the Women's Resource Center is the backbone agency for the Newport HES. We have been since 2015. My specific position is kind of overseeing. I co-manage the project with my co-strategy manager, Jasmine Ray. And we both oversee the different grants that come in. So we have the Department of Health, who was the start of the Newport Health Equity Zone. And obviously since 2015, a lot of that has changed, more funding, different projects that are going on. So I really oversee the different strategies, do a lot of reporting, a lot of, how are we going to actually put these strategies into effect? And then we have a whole great team that's actually on the ground as well. They're kind of specialists in the different areas.
Great. Thank you for clarifying that. Sorry for my jumping right into
No.
Super excited to have you here. So what are some ways that the Newport HES are working to enhance like the socioeconomic aspects?
Yeah, so we are supporting the North End Equitable Development Strategy that is happening within Newport. And we also supported the creation of the local advisory group. And that group is addressing some of this North End Equitable Development Strategy. Some tools have been created to support some of the socioeconomic conditions of the North End. In the short term, the plan calls for creating an asset map that includes all training programs in the area, which are available to North End residents according to their skill level and resource for members of the North End community, increasing funding for VOTEC or vocational training programs that the neighborhood residents benefit from, identifying gaps in training programs and sources and funds to create them, including workforce development and hiring provisions specific to North End residents, monitoring enforcement of the local workforce requirements, including in community benefits agreements. And kind of in the long term, this plan is going to call for more opportunities for local oriented businesses to flourish, intact the local small business retention plan, creating a North End business improvement, and giving residents a stronger voice in providing and permitting the commercial development and neighborhood services within the North End.
Wow. I think it's great how one of the big things of HES is really involving the community. I really think that there's a lot of times you go into a meeting and you see people who have good intentions, you know, putting together a program, but they don't have that community input. So I think it's really good that the work that HES is doing.
Yeah, and there's only so much that people will take from HES, right? When they see our staff faces all the time, or some of us don't live here. And so we can argue about the benefits that need to happen or fight for as much as we can. And we do that supporting the residents. But at the end of the day, coming from the residents, it's a lot more meaningful. Residents know what they need, right? They know. So yeah.
Definitely. Great job.
Yeah. What are the main focus areas of community life that the HES works towards?
Yeah, so the Newport HES has 6 working groups. These consist of greening urban spaces, which is our open space working group, food access, transportation, housing, arts and culture, LGBTQ plus health. We also support the organizing of the collective of phenomenal women. In addition to the work that falls under these working groups, we are also engaged within the equitable development work and supporting the capacity of that local advisory group that I spoke of.
Now, are these groups, are they the same as programs, or does HES have programs that they do as well?
Yeah, so they are separate. They are open working groups that are open to any resident or any partner that wants to contribute and be a part of it. Since its establishment in 2015, the Newport HES has moved slightly away from the programmatic role and more into a policy lens. What that means is our roles are more to convene, assess, support capacity building, and engage within an advocacy. So we are bringing stakeholders together with residents. We're trying to keep a pulse on community needs, the effectiveness of different projects that are being done within the community, whether they are our projects or other people's projects that are being brought into the community, and advocating for those policies and practices that improve health equity. But we don't entirely rule out programs. If a resident comes to us and they do want to do a program and they feel like it doesn't already exist, is when we will look for the funding or support in any way that we can. We don't want to duplicate services. We want to make the services better, right? That are already within Newport. But one program that we do continue to support is the Women of Color Breastfeeding Support Group. And that is run by local doula Letitia Michelle. She runs this support group because of the asks and the needs of the community that, they didn't feel comfortable going to other ones. Right. So that is one program that we do support.
Great. Thank you.
Nice. Can you describe the process of community assessments and why they're important to the work that you do?
Yeah, so community assessments are extremely important to the work that we do. These assessments guide our entire work plan. When we first started the HES in 2015, we completed our large overall assessment. It was about, I can't even think about how many questions it was. It was so many pages, and this really set the stage for the work that we were going to do. We recently just did an update of that to try to see, did we move the needle? Have we done any different? Now, given it was COVID, it was very difficult to do that.
Right.
But in addition to our larger assessments, we do continuous assessment kind of throughout the year. So if there is a project or a program that we're running, we want to know, we don't want to wait an entire 4 years to update that large assessment again. And then even, for example, when COVID hit, was right during the time that we were supposed to be updating our large assessment. We knew people were dealing with all kinds of things, and it was not the time to throw a 25-page survey at them and say, tell us where you get your fruits and vegetables. Tell us how you get to the park. Are there open spaces that you would want to improve? It wasn't the time for that. But we do know that the community was dealing with something serious, and we needed to know how we could be a support of that, because that was going to shift our work entirely. So we were able to develop a smaller survey, sort of. We went directly to people and asked them to talk to the people within their community. And that's how we were getting information at an assessment level. And during that time, that really shifted the work that we do. So overall, community assessments are so important. The work that we do is constantly changing daily. And we've seen that during COVID. We put a halt to all of our work and was like, how are we doing on the ground's direct COVID need, which isn't something we ever did. The HES doesn't do direct service, but it was something that was needed at the time.
Well, it's great to hear the way that the organization pivoted, but when it had to for COVID reasons. Now, with this community assessment, and you emphasizing how important it is to the community and to your work, how important do you feel community collaboration is when working with HES?
Yeah, so community collaboration is key to all our work. We wouldn't be here doing the work that we are doing without the collaboration of our partners, of our residents. When we got this grant to do the HES originally, we looked at it as we were only going to be here for 4 years. So what could we get done in 4 years? We didn't think that there was going to be funding after. We were working towards basically not having a job, right? We say this joke all the time. We want to work ourselves out of not having a job. We want to ensure that, what we're creating is lasting. And without that collaboration, it's impossible, because eventually HES won't be here. But these organizations that have been here for 30, 40, 50 years, they will still be here.
Right.
So collaboration is key, ensuring we're supporting the capacity building of those organizations, of our partners, so that they can continue this work when we're long gone.
Can you tell us about winning the Outstanding Smart Growth Award and the work that went into that?
Yeah, winning this award was a great feeling, especially for the residents who put so much time and effort. It was so much time and so much effort of, so many meetings, so many times of just figuring out what the heck was going on. You first needed to learn what was going on. Then you needed to learn, what are the skills, what are the things that you can be bringing to support this work, and seeing it be recognized. This is the kind of advocacy and lasting change that HES really wants to be known as. And this is how we're going to be disrupting these systems and creating these opportunities for residents to be a part of this.
Now, doing this work, what would you classify as the most rewarding part of your job?
The most rewarding part, I guess I'd say like being able to see, or like working with, there are a few residents I worked with really closely, and seeing them from when they just knocked on our door to figure out what they're doing, and now seeing them on boards and commissions and running for city council or running for school committee. And it's just great to see that, and building the confidence and feeling like they have a whole team that backs them up. That is super rewarding. And just overall relationship building is my favorite part. You didn't ask me what my favorite part, but I'm going to tell you anyways. My favorite part is really the relationships. I mean, there are some residents that, I go and see in Christmas. I have Christmas dinner with, I celebrate my birthday with. Like, this is a family that we're creating. And celebration is a big part of what we do. And we love to celebrate the people that are a part of our lives and a part of this work.
That is great. I too love the relationship building of nonprofit. I think it's the key. I think it's the first and foremost thing. So.
It is. Trust is the biggest thing. And if you don't have trust, you don't have anything. Right. When you really want to come in and support.
Are there still opportunities for community members to get involved?
Absolutely. There are, all of our working groups are looking for residents. If residents don't want to be a part of a working group and they just want to be a part of, that goes for partners as well. If you're just interested and you don't want to commit to anything as well, that's fine. but we are. We are currently back in the office a little bit, so we are trying to figure out what is our next steps of being out in the community. We want to be out of the office and within the neighborhood, talking to people. So we're working on that right now, but open to anyone that wants to be a part in all different levels.
Right. Now, for those people in the community who do want to be a part and who do want to learn more, what is the best way to contact?
Yeah, so the best way to contact would be to either visit our Facebook page. You can message us at Newport Health Equity, as well as coming to 1 York Street on 1 York Street in Newport. It's at the Florence Gray Center. And then also our phone number. This is my phone number.
You can say it if you want. It's up to
Well,
you.
it's the head's office, but 401-236-8344.
I would advise against like social security number, but your phone number.
I just meant like, is someone really going to write that down while they're listening? I don't know, but they might.
You never know.
Do you have opportunities for youth in your community to join in some?
So we are open to youth also in any of our working groups. We don't say any age. We really don't cap on any age at all. We don't do direct youth. Like we don't have a strategy that explicitly says youth, X amount of youth or a youth program. But we definitely love to have youth involved in all of our work.
All right.
As do we.
And now joining us, Joyce Sims, Health Equity Zone Community Health Worker. How are you doing today?
I'm doing pretty good. How are you guys?
Doing good, doing good.
Yeah, doing well today.
Thank you for joining us. So I just want to jump right in. And how did you become involved with the Newport Health Equity Zone?
So the Health Equity Zone has a partnership with Rido to place a community health worker, and they offered to place one here at Conexión Latina. So that's how I became involved.
Wow. Now, was this something that was posted, something you heard about? Was there like a community meeting, or how did it come about that you got involved?
So Rebecca Gomez reached out to me, and because of my previous background, she was able to see if I was interested in the position, because it was the community health worker position was being brought into Conexión. So she reached out to me to see if I was interested, and that's how I became involved.
Wow.
And I'm going to go out on a limb, and I'm going to assume you speak Spanish.
I do.
I could tell by the way you said Conexión Latina, nothing
Yes.
like I say it.
Yes. My mother's from Honduras, so I learned how to speak Spanish at a very early age. So yeah, I'm thankful for that.
That is awesome. It's greatly needed as well.
Yes.
How long have you been in this position?
I started in December of 2021, December 7th, until now.
And what's one of your favorite aspects of work so far?
One of my favorite aspects is helping the individuals that come in here and they leave here satisfied with the help that I have given them. So some of the things that I've kind of assisted some of the clientele that has come in here has been as simple as helping them to navigate their phone. So I mean, just as simple as that. Like, they've been pretty satisfied with that type of help. So yeah.
All right.
That's terrific. So what's your area of focus? Geographically, demographically?
So we usually do the Newport and any surrounding areas of Newport. So like, we have people that come from Middletown. I've had a couple of people come here from Bristol, Fall River, to get some of the help. Just, I think, word of mouth. So typically we want to focus on like the surrounding areas of Newport.
But you're not going to turn anyone away if they show up.
Right.
Yeah.
That's great for you. Your word's getting out. People come up from a whole different state over to see you. So great
I
job.
know, right?
What are some of the responsibilities of a community health worker?
So some of the responsibilities is kind of communicating with dental professionals, mental health professionals. I've had folks come in here needing assistance with making appointments, helping patients to communicate with their medical provider. If they're like, just kind of mentally preparing them for an appointment. So just saying, like if they don't know what to ask the doctor, having them kind of come create like a list of questions and stuff like that, so that they're mentally prepared, to kind of go in, and if they're like uncertain about something, kind of having that like format so that they can ask the doctor, hey, this is what I have. I want to ask you a couple of questions. Here they are.
That's great. I know sometimes I leave the doctor and I wish I had asked a bunch of questions, and had I been pre-planning my questions, it probably would have been helpful.
Yeah, I think that's important because I think, we do go into the doctor's office, and oftentimes when we go there, we go there for a simple physical, and they check us out, and then, you're out the door in like 20 minutes. And then when you leave there, you're like, oh, but I had a question about this, and I had a question about that. And what about this area back here? And so I think just kind of being like prepared in advance, I think is important, because sometimes you forget and you don't end up asking, and then you end up having, like, say you had like a shoulder issue, and then that pain is still there until you decide to go back to the doctor again. And sometimes it can be neglected, and it could be something serious.
Yeah,
so
absolutely. How important do you feel it is for the community to be involved in helping making change within the community? I know that's the HES's model, to get the community involved in making their own change. So how important do you think that is?
I think it's important for the community to be involved, to become knowledgeable of the services, to then inform others of services out in the community, to become more self-sufficient. Just kind of having, others come in here and they are trying to help themselves, and then, word of mouth, they pass that information along, and then, kind of helping them with that, just kind of informing them so that, the next person that they pass this information to, it's just kind of assisting them to kind of understand what's out there, so that they can too be self-sufficient for themselves, and maybe, give the next person advice and say, hey, this is what you can do to kind of better yourself and stuff like that. So I think just being knowledgeable of the services and things in the community.
Being so involved in their lives, do you ever feel like you're becoming part of the family?
Absolutely. All the time. I feel like I get too involved. I get too involved. And it's kind of hard to kind of reel it back, It's like you become part of them, and then it's like like when they're going through something, it's like you kind of take them under your wing, and you kind of, it's like you're trying to teach them, but you also kind of doing it for them. So I think, yeah.
It's like being a parent all over. When you want your kid to do this, but they do that, and you're like, oh, I really wanted you to do this.
Yeah, I know it is. Yeah. So, but I mean, I think we should be like teaching them like do for, do with, and then cheering them on so that, like they could get it and then just be like, all right, I can do this,
Yeah.
Building up some confidence. Yeah.
Right.
Yeah. What do you see as some community opportunities?
Oh, just to have culturally and linguistically accessible services. So just not having like a language line. So when we have different folks that come in here looking for mental health services, oftentimes they have to utilize the language line in order to receive the services that they need, but that's not really connecting with anybody. So I think that would be one of the things that they would benefit from.
You would think in today's age that that wouldn't be a barrier, but it's such a huge barrier.
In
that-
Newport,
Yeah.
especially. I think once you go more to the Providence area, there's a little more things available, whereas here, I think that it's not, and it's been like that for a very long time. I think it's getting better, but I just feel like, we need more.
Yeah. I mean, it's the most diverse of
Yeah.
Newport County, and just for the tourist factor as well. I mean, you have people
Yeah.
coming from everywhere, especially with the yacht race or the boat race that
Yeah.
goes on. Yeah. I mean, all the different festivals, you would think that we'd have more services.
Yeah.
If you had to choose one area for change, what would it be?
It would be to have more people of our own community in positions that can support the community more.
Great point.
Maybe Spanish speaking that are already currently in the community to come forward.
That's great.
It is great. Yes. I know we feel like we're pretty connected to what's going on in the county, and we did a project with the local high school last year. And when we reached out to have things translated, we were so surprised at how many Spanish speaking students there were. I think it was almost a third of the student body was Spanish speaking. And
Yeah.
so get a little bit of a wake up call that we weren't really in tune as we thought we were. So
That's true.
So Joyce, people listening, if they wanted to get in contact with you, what's the best way to contact?
They can either come in to the office or they can contact our organization to get in contact with us.
All right.
all right. Thank you so much, Joyce.
You're welcome.
Thank
All
you.
right.
Thanks, Joyce.
Thank
Nice
you.
meeting you.
Nice meeting you guys.